Thank you so much for coming. Welcome to this event. We're so excited to have you here. I'm Ashley. I'm a third-year medical student at UCI, and I'll be hosting the event tonight. We are doing a play reading of Margaret Edson's 1999 Pulitzer Prize winning play, Wit, followed by a short talkback with the cast and a discussion on cancer, palliative care, and poetry. And we are incredibly lucky to be joined by the author, Margaret Edson. This was actually a huge surprise for me too. And so I will cede the floor to you, so to speak.
Thank you. I'm here because my friend Sarah Blanton, who's the editor of the Journal of Humanities in Rehabilitation, just emailed me out of the blue and saw that this event was happening and said, why don't you Zoom bomb? And so here I am Zoom bombing. I'm very pleased to be here, and I'm really honored that you all find the play Wit to be useful to you in some way. When it was first written, the performance of it was the end, and what has happened to it since is that the text is the beginning of a set of discussions, and that's what's very interesting to me. So it's become a tool for teaching and learning in all different disciplines, high school AP English, bioethics, chaplaincy training programs, and of course with you in medical school and you in the theater school. We're glad that you're here also. It's a school night for me, and it's 3 hours later in Atlanta, so I do need to get to bed because tomorrow is the Friday of spring break, and it's all hands on deck in middle school, which is where I teach. But I just want to say one quick thing before. What I want to draw your attention to is the difference between thinking in categories and thinking in particulars, thinking in situations. Professor Bearing thinks in categories. There's me, there's this, there's the poetry, there's correct, there's incorrect, there's A, there's B. Everything that happens, she places into a framework that already exists for her. Susie and Professor Ashford do something different. They think in each moment. They think of each person they're with. They think not in categories, but in particulars. And so Susie treats Professor Bearing the way she senses that she wants to be treated. Professor Ashford tells Professor Bearing at the very beginning, your paper's terrible, do it again. This is not good enough. But then she realizes this situation calls for something completely different. And so she changes her advice in the middle of the conversation and tells her to do the opposite, says, don't write the paper again. Dr. Kelekian, the attending, does something very similar. Susie says, should we use patient-controlled analgesic? And he says, ordinarily, yes, but in this case, no. Meaning there's a category that we could put her in, but in this particular, we want to think of her as herself, not as a category of patient. So as you're going through the reading, as you're going through your training, and as you're going through your career as doctors, if I could give you something, it would be this, to think in particulars and not in categories. I hope you have fun this afternoon, this evening, in your reading. And again, I'm speaking from my heart when I say how honored I am that the play has meaning for you. And I thank you for the opportunity. Thanks a lot.
Oh, we're honored to have you. So thank you for giving us this play and the opportunity to have this discussion, to have the moments that we're about to have. And
have fun, break a leg.
Thank you. Good luck with spring break.
Thank you.
Yes. So this performance is put on by some wonderful MFA acting students from the UCI Trevor School of Arts. And our stars are Chantrell M. Lewis as Dr. Vivian Bearing, Heather Lee Echeverria as Dr. Kelekian, Rachel Sharp as Professor Ashford, Nick Exum as Jason Posner, and Olivia Wilder as Susie. Without further ado, this is Wit.
Hi, how are you feeling today? Great, that's just great. This is not my standard greeting, I assure you. I tend towards something a little more formal, a little less inquisitive, such as say, hello. But that is a standard greeting here, so I just say, fine. Of course, it is not very often that I do feel fine. I have been asked, how are you feeling today? While I was throwing up in a plastic wash basin. I have been asked as I was emerging from a 4-hour operation with a tube in every orifice, how are you feeling today? I am waiting for the moment when someone asks me this question and I am dead. I'm a little sorry I'll miss that. Irony is a literary device that will necessarily be deployed to great effect in this dramatic structure, as I am a professor of literature. I ardently wish this were not so. I would prefer that a play about me be cast in the mythic, heroic, pastoral mode, but the facts, most notably, stage 4, metastatic, ovarian cancer, conspire against that. I have been, at best, an unwitting accomplice. It is not my intention to give away the plot, but I think I die at the end. If I were poetically inclined, I might employ a threadbare metaphor. The sands of time slipping through the hourglass. Now our sands are almost run, more a little and then dumb. Shakespeare. I trust the name is familiar. I'll never forget the time I found out I had cancer.
You have cancer.
Go on.
You present with a growth that unfortunately went undetected in stages 1, 2, and 3. Now it is an insidious adenocarcinoma.
Insidious. Curious word choice.
We are developing an experimental combination of chemotherapeutic drugs designed for primary site ovarian with the targeted specificity of stage 3 and beyond administration.
Like cancer, nature's changing course untrimmed.
The first week of each cycle, you'll be hospitalized as an inpatient. The next week, you may feel a little tired, and the next 2 weeks, you'll be fine, relatively. This cycle will repeat 8 times. This treatment is the strongest thing we have to offer you. And as research, it will make a significant contribution to our knowledge.
Knowledge. Yes.
The important thing is for you to take the full dose of chemotherapy. There may be times where you'll wish for a lesser dose due to the side effects, but we've got to go full force. Dr. Bearing.
Yes.
You must be very tough.
You needn't worry.
Good. Excellent.
I have cancer. Insidious cancer. Stage 4, metastatic ovarian cancer. There is no stage 5. Oh, and I have to be very tough. It appears to be the matter, as the saying goes, of life and death. I know all about life and death. I am, after all, a scholar of John Donne's holy sonnets, which explore mortality in greater depth than any other body of work in the English language. And I know for a fact that I am tough, a demanding professor, uncompromising, never one to turn from a challenge. That is why I chose, while a student of the great E.M. Ashford, to study Donne.
Do it again. You must begin with a text, Miss Bearing, not with a feeling. Death be not proud, though some have called thee mighty and dreadful, for thou art not so. You have entirely missed the point of the poem because you have used an edition of the text that is inauthentically punctuated. In the Gardner edition.
That edition was checked out of the library.
Miss Bearing, you take this too lightly. This is metaphysical poetry. The standards of scholarship and critical reading which one would apply to any other text are simply insufficient. The effort must be total for the results to be meaningful. The sonnet begins with a valiant struggle with death, calling on all the forces of intellect and drama to vanquish the enemy. But it is ultimately about overcoming the seemingly insuperable barriers separating life, death, and eternal life. In the edition you chose, this profoundly simple meaning is sacrificed to hysterical punctuation. And death, capital D, shall be no more, semicolon, death, capital D, comma, thou shalt die, exclamation point. If you go for this sort of thing, I suggest you take up Shakespeare. Gardner's edition reads, and death shall be no more, comma, death thou shalt die. Nothing but a breath. A comma separates life from life everlasting. It's very simple, really. With the original punctuation restored, death is no longer something to act out on a stage with exclamation points. It's a comma, a pause. This way, the uncompromising way, one learns something from the poem, wouldn't you say? Life, death, soul, God, past, present, not insuperable barriers, not semicolons, just a comma.
Life, death. I see. It's a metaphysical conceit. It's wit. I'll go back to the library and rewrite the paper.
It is not wit, Miss Bearing. It is truth. The paper's not the point.
It isn't?
Vivian, you're a bright young woman. Use your intelligence. Don't go back to the library. Go out. Enjoy yourself with friends.
I went outside. The sun was very bright. I walked around and passed. There were students on the lawn talking about nothing, laughing. The insuperable barrier between one thing and another is just a comma. Simple human truth, uncompromising scholarly standards. They're connected. I just couldn't. I went back to the library. Moving on.
Hi, Professor Bearing. I'm Dr. Posner, clinical fellow in the medical oncology branch, working with Dr. Kelekian. Susie is one of our nurses. Professor Bearing, I took your course in 17th century poetry.
You did?
Yes, I thought it was excellent. I made a bet with myself that I could get an A in the 3 hardest courses on campus.
How'd you do?
Success.
Really?
A minus. It was a very tough course. Susie, I'll call you.
Okay.
Now, I'm going to be taking your history. It's a medical interview. How are you feeling today?
Fine. Thank you.
How old are you?
50.
Are you married?
No.
Are your parents living?
No.
Any siblings?
No.
Well, that about does it for your life history.
Yes, that's all there is to my life history.
When did you first notice your present complaint?
About 4 months ago. I felt a pain in my stomach, then it would go away. I would be tired, exhausted. I was working on a major project. I had a very strict deadline. So I went to Dr. Chin, my gynecologist, after I had turned in the article. She examined me and sent me to Jefferson, the internist, and he sent me to Kelekian because he thought I might have a tumor.
That's very interesting. Well, I guess I'll start the examination. Oh, I have to go get Susie. Gotta have a chaperone here, some clinical rule. I'll be right back. Don't move.
Death be not proud, though some have called thee. Mighty and dreadful, for thou art not so. For those whom thou think'st thou dost overthrow. Die not, poor death, nor yet canst thou kill me.
Has anyone seen Susie? She was here just a minute ago.
Thou art slave to fate, chance, kings and desperate men, and dust with poison, war, and sicknesses dwell. And popular charms can make us sleep as well. And better than thy stroke, why swell'st thou then? One short sleep past, we wake eternally, and death shall be no more. Death, thou shalt die. That was hard. That was. One thing can be said for an 8-month course of cancer treatment. It is highly educational. I am learning to suffer. Yes, it is mildly uncomfortable to have an electrocardiogram, but the agony of a proctosigmoidoscopy sweeps it from memory, and watching myself go bald. As I am a scholar, I feel obliged to document what it is like here most of the time between the dramatic climaxes. In truth, it is like this. You cannot imagine how time can be so still. Hangs, it weighs, and yet there is so little of it. It goes so slowly, and yet it is so scarce. If I were writing this scene, it would last a full 15 minutes. I would lie here and you would just sit there. Not to worry. Brevity is the soul of wit. All right, it is Friday morning, which means grand rounds will now proceed.
Dr. Bearing,
Dr. Kelekian.
Posner,
Professor Bearing, stage 4 upon admission, hexamethylphosphacil with vinplatin to potentiate, hex 300 milligrams per meter squared, vin at 100. Today is cycle 2, day 3, both cycles at the full dose.
Grand rounds. The term is theirs. Here, rounds seems to signify darting around the main issue, which I suppose would be the struggle for life, my life, with heated discussions of side effects, other complaints, additional treatments, full of subservice, hierarchy, gratuitous displays, sublimated rivalries. I feel right at home. It's just like a graduate seminar, with one important difference. In grand rounds, they read me like a book. Once I did the teaching, now I am taught. This is much easier. I just hold still and look cancerous. It requires less acting every time.
Posner,
Oh, right. Professor Bearing, how are you feeling today?
Fine. Wasn't that grand? At times, this obsessively detailed examination seems to me a bit nefarious business. On the other hand, what is the alternative? Ignorance? Ignorance may be bliss, but it is not a very noble goal. So I play my part. I receive chemotherapy, throw up, am subjected to countless indignities, feel better, go home. 8 cycles, 8 neat little strophes. Oh, there have been the usual variations: subplots, red herrings, hepatotoxicity, liver poison, neuropathy, nerve death. They are medical terms. I look them up. It has always been my custom to treat words with respect. So imagine the effect that the words of John Donne first had on me. Ratiocination, concatenation, coruscation, tergiversation. Medical terms are less evocative. Still, I want to know what the doctors mean when they anatomize me. And I will grant that in this particular field of endeavor, they possess a more potent arsenal of terminology than I. My only defense is the acquisition of vocabulary.
can't miss diagnoses with hex and vin.
Myelosuppression, of course, a lowering of blood cell counts.
Neutropenia. Neutropenia.
A low white blood cell count raises concern for neutropenic fever, which must prompt assessment for severe infection and its complications.
When did it start?
I was at home reading. I felt so bad. I called. Fever and neutropenia. They said, come in.
You did the right thing to come. Did somebody drive you?
Cab. I took a taxi.
Here, why don't you sit? I'll get Jason. He's on call tonight. We'll get him to give you some meds. I'm glad I was here on nights. I'll make sure you get to bed soon, okay? It'll just be a minute. I'll get you some juice.
How are you feeling, Professor Bearing?
My teeth are chattering.
Vitals?
Temp 39.4, pulse 120, respiration 36, chills and sweating.
Fever and neutropenia. It's a shake and bake. Blood cultures and urine stat. Admit her. Prepare for isolation. Start with acetaminophen. Vitals every 4 hours.
I think you need to talk to Kelekian about lowering the dose for the next cycle. It's too much for her like this.
Lower the dose? No way. Full dose. She's tough. She can take it. Wake me up when the counts come from the lab.
In isolation, I am isolated. For once, I can use a term literally. The chemotherapeutic agents eradicating my cancer have also eradicated my immune system. In my present condition, every living thing is a health hazard to me.
Really have not got time for this.
Particularly healthcare professionals.
Just to
Morning,
look at
Dr.
the
Bearing.
just to look at the intake and output for 1 minute takes me half an hour to do precautions.
You're doing swell. Isolation is no problem. Think of it as a vacation. Definite progress. Everything okay?
Oh, geez, clinical. Oh, Professor Bearing, how are you feeling today?
Fine. Just shaking sometimes from the chills.
IV will kick in any time now, no problem. Listen, gotta go. Keep pushing the fluids.
I am not in isolation because I have cancer, a tumor the size of a grapefruit. No, I am in isolation because I am being treated for cancer. My treatment imperils my health. Herein lies the paradox. John Donne would revel in it. I would revel in it if he wrote a poem about it. My students would flounder in it because paradox is too difficult to understand. Think of it as a puzzle, I would tell them, an intellectual game. Or I would have told them, were it a game, which it is not. This is my play's last scene. Here heavens appoint my pilgrimage, last smile in my race, idly yet quickly run at this last pace. My span's last inch, my minute's last point, and gluttonous death will instantly unjoint my body and soul. John Donne, 1609. I have always particularly liked that poem in the abstract. Now I find the minute of my minute's last point. The image is a little too, shall we say, pointed. I don't mean to complain, but I am becoming very sick, very, very sick, ultimately sick as it were. In everything I have done, I have been steadfast, resolute, some would say in the extreme. Now, as you can see, I am distinguishing myself in illness. I have survived 8 treatments of hethamexophosphophil and vinplatin at the full dose, ladies and gentlemen. I have broken the record. I have become something of a celebrity. Kelekian and Jason are delighted. I think they foresee celebrity status for themselves upon the appearance of the journal article. They will no doubt write about me. But I flatter myself. The article will not be about me. It will be about my ovaries. My peritoneal cavity, which, despite their best intentions, is now crawling with cancer. But we have come to think of me as, in fact, is just the specimen jar, just the dust jacket, just the white piece of paper that bears the little black marks.
Professor Bearing, just want to check the I&O. How are you feeling today?
Fine.
That's great.
How are my fluids?
Pretty good. No kidney involvement yet. That's pretty amazing with Hex and Bin.
How will you know when the kidneys are involved?
Lots of in, not much out.
That's simple.
Oh, no way. Compromised kidney function is a highly complex reaction. I'm simplifying it for you. We're supposed to.
Bedside manner.
Yeah. There's a whole course on it in med school. It's required. Colossal waste of time for researchers.
I can imagine. Jason?
Huh?
Oh, what were you just saying?
When?
Never mind.
Professor Bearing,
Yes?
are you experiencing confusion, short-term memory loss?
No. I was just wondering, why cancer?
Why cancer? Cancer is
Awesome.
yeah, it is awesome. How does it do it? The intercellular regulatory mechanisms, the malignant neoplasia just don't get it. You grow normal cells in tissue culture in the lab, they divide 20 times or 50 times, but eventually they conk out. You grow cancer cells and they never stop. They just pile up, just keep replicating forever. It's an error in judgment in a molecular way, but why? What's up with cancer cells? Smartest guys in the world with the best labs, funding, they don't know what to make of it.
What about you?
Me? Oh, I've got a couple of ideas, things I'm kicking around. Wait till I get a lab of my own. I can survive this fellowship.
The part with the human beings.
Everybody's got to go through it. All the great researchers. They want us to be able to converse intelligently with the clinicians, as though researchers were the impediments. The clinicians are such troglodytes, like we have to hold hands to discuss creatinine clearance. Just cut the crap, I say.
Are you going to be sorry when do you ever miss people?
Everybody asks that.
And what do you tell them?
I tell them yes.
Are they persuaded?
Some.
I see. And what do you say when a patient is apprehensive, frightened?
Of who?
I just, never mind.
Professor Bearing. Who is the president of the United States?
I'm fine. Really, it's all right.
I could order a test.
No, I'm fine. I'm just a little tired.
Okay. Look, I gotta go. Keep pushing the fluids.
Now I suppose we shall see, through Flashback, how the senior scholar ruthlessly denied her simpering students the touch of human kindness she now seeks. How would you characterize the animating force of this sonnet?
Huh?
In this sonnet, what is the principal poetic device? I'll give you a hint. It has nothing to do with football. What propels this sonnet? Did I say? You are 19 years old. You're so young. You don't know a sonnet from a steak sandwich. By no means. You can come to this class prepared, or you can excuse yourself from this class, this department, and this university. Do not think for a moment that I will tolerate anything in between. I feel so much, what is the word? I look back, I see these scenes, and then I
Miss Bearing? Is that you beeping at 4 a.m? Oh, did that wake you up? I'm sorry. It just gets occluded sometimes.
I was awake.
You were? What's the trouble, sweetheart?
Oh, I don't know.
You can't sleep?
No. I just keep thinking.
If you do that too much, you can get kind of confused.
I know. I can't figure things out. I'm in a quandary, having these doubts.
What you are doing is very hard.
Hard things are what I like best.
It's not the same. It's like it's out of control, isn't it?
I'm scared.
Oh, honey, of course you are. I know. It's hard.
I don't feel sure of myself anymore.
And you used to feel sure.
Oh, yes, I used to feel sure.
Vivian, it's all right. I know. It hurts. I know. All right, do you want a tissue? Vivian, would you like a popsicle?
Yes, please.
I'll get it for you. I'll be right back.
The epithelial cells in my GI tract have been killed by the chemo. The cold popsicle feels good. It's something that I can digest, and it helps keep me hydrated, for your information.
Thanks. Vivian, there's something we need to talk about, that you need to think about.
My cancer is not being cured, is it? They never expected it to be, did they?
Well, they thought the drugs would make the tumor get smaller, and it has. It's gotten a lot smaller, but the problem is that it started in new places too. They've learned a lot for their research. It was the best thing they had to give you, the strongest drugs. There just isn't a good treatment for what you have yet, for advanced ovarian. I'm sorry, they should have explained this to you.
I knew. I read between the lines.
You did. What you have to think about is your code status. What you want them to do if your heart stops. You can be full code, which means that if your heart stops, they'll call a code blue, and the code team will come and resuscitate you and take you to intensive care until you stabilize again. Or you can be do not resuscitate. So if your heart stops, we'll just let it. You'd be DNR. You can think about it, but I wanted to present both choices before Kelekian and Jason talked to you.
You don't agree about this?
Well, they like to save lives. So anything's okay as long as life continues. It doesn't matter if you're hooked up to a million machines. Kelekian is a great researcher and everything, and the fellows like Jason, they're really smart, but they always want to know more.
I always want to know more. I'm a scholar. Or I was. When I had shoes. When I had eyebrows.
Well, okay then. You'll be full code. That's
No.
fine.
No, don't complicate the matter.
It's okay. It is up to you.
Let it stop.
Really?
Yes.
So if your heart stops beating,
Just let it stop.
sure.
Yes.
Okay. I'll get Kelekian to give the order and then
Susie,
Vivian.
you're still going to take care of me, aren't you?
Of course, sweetheart. Don't you worry.
That certainly was a model and display. Popsicles, sweetheart. I can't believe my life has become so corny, but it can't be helped. I don't see it any other way. We are discussing life and death, and not in the abstract. We are discussing my life and my death, and my brain is dulling, and I can't conceive of any other. Now is not the time for verbal swordplay, for unlikely flights of imagination, or wildly shifting perspectives, for metaphysical conceit, for wit. And nothing would be worse than a detailed scholarly analysis, interpretation, complication. Now is the time for simplicity. Now is the time for, dare I say it, kindness. I thought being extremely smart would take care of it, but I see I have been found out. Oh, I'm scared. Oh God, I want to hide. I just. I want to tell you how it feels. I want to explain it. I want to use my words. I can't. There aren't. It's as if I'm a student and this is the final exam and I don't know what to put down because I don't understand the question and I am running out of time. The time for extreme measures has come. I am in terrible pain. Susie says that I need to begin aggressive pain management if I am going to survive it. If I'm going to stand it. It. Such a little word. In this case, I think it signifies being alive. Oh God. Oh.
It's okay. Shh. It's okay. I paged Kelekian up here and we'll get you some meds.
Oh God, it's so painful. So much pain.
I know, it's okay. Just try and clear your mind. It's all right. We'll get you a patient-controlled analgesic. It's a little pump and you push the button. It's very simple and it's up to you. It's time for PCA. The pain is killing her.
Dr. Bearing, are you in pain?
Am I in pain? I don't believe this. Yes, I'm in goddamn pain. I have a fever of 101 spiking to 104, and I have bone metastases in my pelvis and both femurs. There is cancer eating away at my goddamn bones. I did not know there could be such pain on this earth. Oh God.
I want a morphine drip.
What about patient controlled? She could be more alert.
She's earned a rest. Morphine, 10, push now. And then start at 10 an hour. Dr. Bearing, try to relax. We're going to help you through this. Don't worry.
Vivian? It's Evelyn. Vivian?
Oh God. Professor Ashford.
I'm in town visiting my great-grandson who is celebrating his 5th birthday. I went to see you at your office and they directed me here.
I feel so bad.
I know you do. I can see. Dear, there. Vivian. There, don't worry, dear. Let's see. Shall I recite to you? Would you like that? Something by Donne?
No.
Very well. The Runaway Bunny. Once there was a little bunny who wanted to run away. So he said to his mother, "I am running away." "If you run away," said his mother, "I will run after you, for you are my little bunny." "If you run after me," said the little bunny, "I will become a fish in a trout stream and I will swim away from you." "If you become a fish in a trout stream," said his mother, "I will become a fisherman and I will fish for you." Look at that. A little allegory of the soul. No matter where it hides, God will find it. See, Vivian?
Mm-hmm.
"If you become a fisherman," said the little bunny, "I will be a bird and fly away from you." "If you become a bird and fly away from me," said his mother, "I will be a tree that you come home to." Very clever. "Shucks," said the little bunny, "I might just as well stay where I am and be your bunny." And so he did. Wonderful. It's time to go. And flights of angels sing thee to thy rest.
Hi. How are you feeling today? These are my last coherent lines. It came so quickly after taking so long. Not even time for a proper conclusion. And death shall be no more. Death, thou shalt die.
Well, everyone, that is our performance of Wit by Margaret Edson. I would like to invite the cast back up for a few minutes. We are not going to have enough time for a traditional talkback, but I wanted to go around and just would each of you introduce yourselves and tell us a little bit about what drew you to the play and your inspirations for the characters or anything you want to share with us. Olivia, do you want to start?
Yeah, I'd love to. Hi, everyone. I absolutely love this play. I read it for the first time in undergrad, and as someone who spent a lot of time on the patient side in hospitals, it is it makes such a huge difference when somebody sees you as a person. And I also really appreciated the care taken in writing this script and finding the humor in illness too. There's so much time. It's such a serious space to be in a hospital, particularly as a patient, but I can't even imagine as someone who is caring for others. that when there are times when someone can find humor or kindness or like connection, I think is the most important, at least to me, to really see another person, which is really all I'm trying to do in theater as well, is try to see and empathize and like understand somebody else's story. So that's why I love the play. And I mean, it's been such a cool collaboration to be able to work on this script with someone who knows the terms that we're talking about. So that's been really exciting for me. But yeah.
Thank you. I really love your point about, one of the goals in theater of being able to connect and empathize, to find like the humor and, like the moments of care and everything. And that's why we're doing this event, because it's something that we hope always shines through in our practice of medicine and in the way that we interact with each other. Nick, do you want to go next?
Yeah, hi, I'm Nick. I had heard so much about this play, but I'd never actually read the full play. And I think what I was drawn to about it was, I think similarly, like feels very like vague and scary, but like I'd spent a lot of time in hospitals, not in relation to cancer, but like I feel like that is my sort of big connection to it, is like I feel like I know these people, even if they're just characters on a page, it feels sort of like familiar and interesting to me in that way. And so like Posner, for instance, feels like someone that I know, like a character that I've run into in my life. And I, like Olivia said, I'm just going to steal everything Olivia said, which is that like I think that one of the things that is so great about this play is all the humor. Even at the darkest moments, there's like this humor throughout that I think is so important for these kinds of stories to have, to help people who then like are experiencing these kinds of things in real life to have that as a tool to get through. Yeah.
Yeah, thank you for sharing. And yeah, one of the goals of this event was to try and help anyone feel very seen and heard. And we hope that you'll contribute to the discussion that we're going to have about the evening about this play. Rachel, do you want to go next?
Hi, everyone. My name is Rachel. Thank you so much for sharing your evening with us. I am an MFA acting student here at UCI. It's my first year. What drew me to this project is I used to follow a professor on Twitter named Dr. Nadia Chowdhury, and she, in the last 2 years, was diagnosed with ovarian cancer, and she documented her journey with it on Twitter. And I followed her for the entire process. And unfortunately, in October of this last year, she passed away. And so to do this piece felt, even though I never met her in person, like a very sweet homage to her and her legacy, which continues today. She spent her last days raising scholarships for her students. So it was truly an honor to be a part of something so special like this.
Wow, thank you for sharing. That truly is like an amazing inspiration to have. And I think that you were very inspiring tonight. So it all comes back full circle. And last but not least, Chantrell, why don't you talk?
Hello, everyone. Thank you for being here and sharing this experience with all of us. For me, what draws me to this play continually, I think it has a lot to do with the writing of the characters. They're all really three-dimensional, and we got to explore a lot of that as we rehearsed this piece. And I feel like none of these people in this play were just one thing or another. They were all things. And I like the realness of that and how that makes the scene between the people more intimate, because they're real feelings, things that I believe real people say or have said or have experienced and done. And the sensitivity of the writing, along with the its uncensored nature, I feel is really impactful and will continue to draw people into this piece.
Yeah, and we're going to continue that discussion of real world connections in our panel. So thank you so much to our amazing, wonderfully talented cast. Before you guys log off, you should read the praise that's in the comments for you. So I want to invite our specialist panel up. So the format of this evening was, as Maggie Edson described, that we're going to use this play now to bring into a discussion, a multidisciplinary discussion about some of the really important themes that this play brings up. Like, how do we process and understand cancer and in the larger picture, chronic or terminal illness? And from that, one of the really important like medical applications is understanding palliative care and hospice. And then of course, this is a play, and it's a play about a literary professor. And so we have our own literary professor here to talk about the connections between this play and poetry and illness for us. And so we have 4 amazing panelists. I'm going to invite you all to turn on your cameras. And I'm also going to ask you guys to introduce yourselves, and as an icebreaker, tell us one thing in this play. We'll start with one that you relate to either personally, or that you think that your work really relates to, or that was like elucidated for you in this performance. So let's start with Professor Lupton.
Well, I mean, I fell in love with this play because it took the poetry of John Donne seriously. And there's like a whole dialogue about commas versus semicolons. What kind of English professor would I be to not love a dramatist who can make the comma into a kind of key to how we think about the passage between life and death, as not a hard break, but as a breath and a soft pause. So I think it's really quite interesting how this play brings together the poetry of John Donne, which is not easy, with end of life issues, which are not easy, and uses wit to kind of craft something that we can bear and learn from. So it's really quite an extraordinary piece. I want to thank the actors for an amazing job, and also Ashley for her vision in this.
Yeah, and will you tell us a little bit about your role at UCI?
Well, I'm a professor of English, and I co-direct the New Swan Shakespeare Center, which is proud to co-sponsor this event. And I've also been very involved in arts across campus through the Illuminations program, which is also sponsoring this event.
Yes, Professor Lupton is being modest. She made this event possible, and I am incredibly, incredibly grateful. Yes. So next up, let's have Dr. Coluzzi. Would you introduce yourself? Tell us a little bit about what you do and one connection to this play.
Sure, happy to. Paul Coluzzi, a medical oncologist here at UCI. And interestingly, as I'm listening to this, I can identify with both. I'll tell you a little more about myself in a moment, but I can identify with both the physician and the nurse. And I think the struggle for medical oncologists to be a little bit of both. And I think that, the nurse sees the patient as a person, the doctor sees the patient as a disease. And so I think it's kind of a classic trope. It's not something particularly, unique in my comments, but I think that's the first thing that strikes me. Interestingly enough, my undergraduate degree was in religion. My actually thesis undergraduate was physician-assisted suicide. Now this goes back to 1981. And so things have kind of come full circle for me over my career. I do breast oncology now, but I did some hospice in the past. And I think I've always felt particularly attracted to oncology because of the intensity of relationships, which is another thing I think you see in the play. Whether it's with the doctor from a little bit of a hands-off perspective, but still intense, and then from Susie's perspective, which is very personal.
Yeah, thank you for sharing. And I think that your interdisciplinary background makes a lot of sense. I think I can see where it has brought you to where you are, in your career and here today. I also have an interdisciplinary background. I was an English major when I was in college, and perhaps that's why we have this event tonight, which I'm
Sure.
so excited that we're all here for. Dr. Dabral, would you go next?
Hi. First of all, I commend all the actors. I was really honored to have the author of the play talk to us in the beginning. It's really good experience. Somewhere in the middle of the play, I forgot it was a play. It seemed to me I'm in the hospital hearing these things, and some of the lines which were used in the play, like I said, I am learning to suffer when Vivian says. It was very strong. It was very, very, very compelling statement, which we sometimes have to read between the lines that, hey, she is not just talking about the disease or the limitation of her life. She's talking about suffering. Another line which kind of I found very strong and it kind of affected me was when she says, brevity is the soul of wit. I think that was just very beautiful use of lines by the author, as well as how she expressed it. So those are the things I really enjoyed in the play, and of course, like Dr. Coluzzi say, him and I have been in this business for some time, the business of medicine for some time, and we have seen things kind of change around. Yes, I'm sure Dr. Coluzzi, but I have seen characters like Posner during early part of my career. Fortunately, we see far and in between the humanity, the humane approach to take care of the patients is that's what I see more now, especially in the last, say, 20 years or so. Some of the things which Vivian is going through, they are very real. And like the author said, Megan said in the beginning, we tend to see a person in bits and pieces. If you read Paul Castle, he passed away. He was a beautiful writer. He was a professor at Harvard. I had chance to spend some time with him, learn from him palliative care. And he writes in one of his articles that a person who is suffering from a life-limiting event, he just feels like part of it is broken and they don't feel whole. They don't feel whole, like a wholesome. So our job, especially in palliative care, comes to help them feel as whole and to see them as a person. So that's about the play and my feelings. I'm the Department of Medicine here, practicing palliative care. I have a background in pulmonary and critical care medicine. That's what I practiced most of my life, and saw a lot of people going through some intensive treatments in the ICUs. And it was just natural for me to just drift towards palliative care, helping with patients in a different way than I have been doing in past. Thank you for having me on the panel.
Yes, of course. Thank you for being here. And the interdisciplinary nature of our discussion has already begun. That beautiful line you mentioned, brevity is the soul of wit, is from Shakespeare. Yes, and so we'll highlight that a little bit more as we continue. And Chantrell, why don't you, I know you've already talked about the play, but I'm gonna ask you to talk some more.
That is right, all right. I relate to this play from many different viewpoints and angles. Like some of my castmates, I have struggled with constant illness since I was a child. So I spent a lot of time in hospitals trying to get my lungs to work. And it's something that even as an adult plagues me daily, but not cancer, but I have the relationship to severe and chronic illness. And so a lot of the hospital moments were really impactful. Even having the props, which are from a real hospital, just smelling the plastic of some of them gave me a little bit of, it brought back some memory, some unpleasant memory. And just relating to the hospital space and some of the language and just the discomfort sometimes that we feel when it seems like there's nothing that can happen to fix us. Because I have felt that before and saying, oh, I'm going to be sick forever. and that's a real thing. That's a real feeling and a real fear that I think Vivian, Dr. Bearing, was figuring out and was also figuring out the navigation of as she continued to live out the rest of her life, how to feel good and how to be full in her livelihood, though she knows that there is something that may or may not happen soon or brief or whatever because of a diagnosis. And on the other end, I believe I relate to this play because for a few years, I worked in nursing homes as a caregiver and just within people's homes. So I took care of a few patients who were on hospice or just much older people who just needed a little bit more assistance. And being in the setting of, okay, now rounds are coming, you're gonna get your medication. And my mom, who is here, she's been a nurse for, I think, 28 years. So I spent a lot of time listening to her talk about things that I have no idea what she was talking about, but also having the experience of her take care of me in home, dealing with the medical condition that I deal with. And the moment where Vivian and Susie are talking and she says, you're still going to take care of me, aren't you? I feel like I've experienced that with my mom, especially when I was younger and when I was really afraid. So the intimacy of those moments, I can relate to in some way. And also being a caregiver of someone who has cancer or had cancer. And my grandmother passed away, unfortunately, from breast cancer. But, you know, like COVID had so many things that were bad. But I think that one good thing that happened during COVID was I got an opportunity to leave campus and to go home and take care of my grandmother for the last few weeks of her life. And that was one of the biggest blessings that I've received during these last few years, was just the ability to go home and to care for her in that way. And so I think reading to the play can be touchy and a little bit very sad for me. It sort of gave me insight to her experience in dealing with the things she was dealing with towards the end of her time with breast cancer. And so that was a really unreal feeling of some of these words. And I just remember some of the things my grandmother has said out loud, not to me necessarily, but out loud as she was going through what she was going through. And I was like, you know what, it feels like Vivian saying that same thing that my grandmother said, but, you know, in a different way. And so it was interesting, similar thoughts or dialogue occur. Yeah. So that's my relationship to this story.
Yeah, thank you for sharing. And I have no doubt that your mom is extremely proud of you. You are incredible. And I just a little bit of insider for everyone. A lot of people auditioned for the roles of Susie and Vivian, and it was very, very clear that Chantrell was the one to play Vivian. And now we know why. That personal connection that you brought was very palpable. Mm-hmm. Yeah. And I think that you kind of gave a great introductory explanation to helping us understand Vivian, which was one of the things I wanted to dive into in our discussion. And I think that understanding Vivian is a big part of understanding this play. And it was very helpful to have you describe kind of the personal and artistic perspective of who this character is, what she is like to play, and what she means, and how real she is. So thank you for that. And I think that something else that will help us understand Vivian more is her identity is wrapped up in being a scholar, being a professor of literature, being the John Donne expert. And so I think that it would be really helpful for us if Professor Lupton, you could explain for us a little bit more some of those references and that element of her character and how it very brilliantly draws back to the medical details and the really heartbreaking situation of this play.
Well, yeah, I mean, there's not a lot of plays that have a female English professor as the main character. And, you know, she's not a lovable English professor, unlike me, right? We see her being mean to her students and, you know, sort of being, as we used to say, married to her work, right? She's single and she's kind of obsessed with her research. And I was a little uncomfortable with some of that. On the other hand, I think what, you know, there's a strong picture being drawn in order to show how she, in her final months, becomes a better reader of literature. Because she says at one point that she has become the poem. And she means by this both that she's being dissected by the young doctor in the same way that she was dissecting the poems for her students. But I think there's something also that she's like learning how to read and be read. And, you know, to be read too, the gorgeous moment when her former professor comes to her room and reads her this children's book, you know, it's so that she's going through a transformation. And unfortunately, it takes being terminally ill for her to have that transformation. But I think we're all being invited to let that transformation in. And just to come back to something that Chantrell said about COVID, I mean, I know that for me, my relationship to literature and to reading and to teaching and to listening, you know, changed in the last 2 years. And, you know, that it's a reckoning, you know, our mortality, the mortality of those that we love, the vulnerability of our communities, right? It makes us care differently about, so I've always loved Shakespeare, I've always loved poetry, but I'm loving them more fully. I'm spending more of my time as a community teacher, less of my time as a researcher with a capital R, because I want to give the gift of literature to myself and to others, because time is short. And so there's a kind of a sharp story being told here, but that's what literature often does, right? You know, Macbeth is a murderer. We've all done things that we regret. Right? She's this harsh teacher who kind of opens up. We could all open up, right? So I think that's the kind of big arc that I saw there. I mean, I could say more about John Donne and metaphysical poetry, but I think the point of it is what role can literature and poetry and drama play in our lives? And there's a comment in the chat about how this play should be used in medical education. I had the honor of attending a session by Dr. Johanna Shapiro, who's here today, recently retired, who ran a lot of medical ethics sessions for medical students. And I saw her using a script for medical students to play out different sides of an encounter, of a medicalized encounter. And drama has such power for that. So I think, I'm sure, I know this play is used in that way. And I can, you know, that, and I think Dr. Coluzzi said something really important, that he sees himself in both the researcher and the nurse, just like I see myself in both the researcher, professor, and the more humane professor, right? We embody these elements and we play them out, and literature helps us kind of separate them and analyze them so that we can bring them back together in our lives and work.
Yeah, thank you for that. Brilliant. And that was such a very helpful, I think, explanation of what the role of literature can and should be versus, you know, what it was in the play and like how we got to the end. I love the phrase, the gift of literature. I think that is a really good description for this play. It's at least, you know, it is a way of like gifting an experience to us through literature. And I am just really glad that we have the chance to unpack that tonight. Yeah, and I also would just like to point out that I know you said that Vivian Bearing was a bit of like an uncomfortable sort of example of a woman in literature. And I also related to that as having previously studied literature. But we have a wonderful foil to her in Professor Ashford, who Rachel beautifully played. In many ways, I think Professor Ashford is the could have and should have been version of Dr. Bearing. She also is uncompromising, is brilliant in her literary study. But when it comes down to the moment of actually living, she's the one who tells Vivian to go outside, hang out with your friends. And she's the one who comes back decades later with the moment that like I think really helped give Vivian peace and like a sense of farewell to her journey. And so I'm really glad that the play like represented that spectrum very well. Yeah. And so I wanted to ask Dr. Coluzzi, I think that your work is really relevant to some of the questions that are brought up in this play, which is, how do we sort of process the experience of cancer? And also, I think this play tries really hard to show that it's not just being diagnosed with a terminal illness that is scary and very real and heavy, but that there are a lot of other challenges and questions that come with this that we might not even think of, such as like the code status discussion that she has with Susie and some of the little things that she minimizes, but that we might not think about. And so I was hoping that you could talk about your work with cancer patients, and you didn't mention the survivorship program that you run at UCI.
Well, I mean, there's not a lot of time to talk about everything, but survivorship would be interesting in the sense that you could even apply some of the principles of that, of self-growth, of self-care, even for Vivian. And I think Vivian's doing that as she kind of moves through, as Dr. Lupton explained, her metamorphosis to becoming the better or the more evolved professor, so to speak. I think a couple of things are that always comes to my mind, and for those in the audience that are either in medicine or just in general, one thing we don't do a very good job of, and it was brought up by Vivian when she said, I read between the lines, when Susie said, well, did you think you were going to be cured, or something to that effect? And I think that's something I always try to make very clear to my patients. Whether we're curing or whether we're palliating, meaning we're trying to prolong life and improve quality of life over time, because there's a lot of new things in oncology that actually may not cure patients, but you may live many, many years, and you can live quite well with it. So I think one of the things as a physician we need to do is do a better job of communicating to patients and the public what the goals of care are up front. So that then it's a little more seamless, the transition towards, we knew this wasn't going to be cured. Now's the time to shift our focus to comfort. And I think that's something that I try to do with all my patients who have advanced cancer. And I think it makes the job a little bit easier for me. I think it makes it easier for the patient. I think patients want to know that. The vast majority of patients want the truth, so to speak. So I think that's an obligation we have. I think Posner has a hard time with that because he's seeing her as a disease to a certain degree. He's seeing her as a means to an end for his research. My experience of doing this for as long as I have, patients want to live they want to live as long as they can, but they really want to live as well as they can. I think most people are realistic. We only see patients from a very, really not a very broad perspective, because we only spend time with them in the office. We may get to know them, their families and so forth to a certain degree, but we really don't know the breadth of them as humans. So there's always a little bit of a challenge with that. I think with patients who are referred to hospice sooner rather than later, I think that team gets to know the patient more from a human perspective, so to speak. So I think that's important, the support of oncology, with palliative care, that we kind of get involved with the multidisciplinary approach. When one person we don't have here, which is unfortunate, we don't have a nurse representing what is it like to meet the patient at that point in their illness, or a social worker, because they look at everything a little bit differently than do physicians. I always try to kind of understand that a little bit. I think, interestingly enough, what Dr. Lupton had said is I kind of find literature for myself, which is I love reading more than almost anything, is I love the way it represents, there's never a clear picture usually. The best novels, the best fiction always kind of shows you multiple sides of the character. And that's something we don't get enough time to see in patients. So I always try to respect that and know that there's a lot more going on than I see. But I do know from my experiences, patients want the truth and they want you to be straightforward, and they want you to help them when it's appropriate to transition with an opinion like Susie had. I mean, Susie gave her a choice, but I think she had the strength to come to say it's time to talk about this. So I think that's something that physicians do, and we're doing a better job of it over time. And the palliative care specialists are helping us with that. So hope that answered your question.
Yeah, I think like this is sort of a very open forum. We're all trying to learn, and I think you brought some really excellent points for all of us to kind of think about and learn from. And Dr. Dabral, I would love for you to expand on that. One thing I really like that you summed up, Dr. Coluzzi, is that patients want to live well. There was a book that was very, very popular when it was first published, and I think it's still an incredible book, Being Mortal, by Gandhi. And I remember in the book, he talks about this question of like mortality and aging and dying, and how are the ways that we have done that? How are the ways that we have changed in that, and how should we move forward, and what are the experiences like for people? And he says at one point, from the perspective of a doctor, that patients always want to, or always ask, is there something you can do? And he writes, I may not be quoting it exactly, but I'll paraphrase it. He says something to the order of, there is almost always something we can do. The question is, do you want me to do it? Because the effects may or may not be what patients want. It may or may not allow them to live well. It may just allow them to live. And so, Dr. Dabral, I was hoping you could expand on some of the questions you've already started talking about. In particular, in your experience in palliative care, what are some things that you have found helpful for patients and their families who are going through the experience of grappling with a terminal or chronic illness? What are some of the things that we talk to them about that are important for them to consider? And I think in this audience, we have a lot of people who relate to that.
Let me try to address those one by one. First of all, going back to the play, the characters in the play, they in fact reflect at what level of anxiety and what level of life situation we are at, and the way we behave, why we behave, what role we are playing at that time, what circumstances we are at. As far as how do I see it in our day-to-day life? So palliative care is relatively a new specialty. The specialty was developed, carved out actually, out of multiple other subspecialties because no matter what kind of underlying diagnosis a person has, they all go through different types of sufferings. So suffering could be physical, pain, and like this, our Vivian was having vomiting and fevers. Suffering could be at the level of existential, spiritual level. That has not been addressed traditionally in medicine in past. And then sufferings can be social, what kind of environment they are at. Here, our character is lonely person. He has no relation with anybody else but her work and her students and her research. And finally, the emotions, everybody's emotions are different, and how this psychosocial component affects on their emotions, which they are expressing. So when we see a patient who has either chronic disease or any condition with a lot of symptoms or a life-limiting disease, we approach that patient in a multifaceted way, and we provide it not as a single provider, but we provide care as a team. And the team consists of course, physician. There is a specialized nurse or nurse practitioner. Then we have a social worker, and then we have a spiritual care support chaplain services. So we all address, we talk to the patients, we kind of get the information from the patient, kind of feel the patient out in a comprehensive way so that we can help them navigate their treatments while they are seeking life prolonging treatments, or help them towards the end of their life, transitioning them to hospice care, preparing them for hospice. So that's what we do. It's a team approach. Again, going back to the theme of the play here, and medicine, I think it's changing a bit now again, but in the last 20 years, 25, 30 years, we have become more of an interventionalist. We see somebody with fever, we want to give Tylenol. We see somebody with potential infection, we want to give them some antibiotics. We see them with cancer, we want to give them cancer treatment. And that's what the society has begun to expect from us. So I can see from oncologist's point of view, when a patient with advanced cancer goes, they want to give them something because patient is expecting something. The thing is, as the disease and the treatment continues, the hope which they had from the cancer specialist or the provider, the hope of cure needs to be transitioned into hope of quality of life. And I think that's what we are referring to. How we can provide them better quality of life. It can be with medical assistance, or it can be otherwise. So palliative care helps kind of dig through all these possibilities and help the patient out through those ways. Thank you.
Very helpful. All right. We're at 7:54. And so as we wind down, I wanted to go back through everyone. And if there is one takeaway thing that you would like the audience to think about, to remember from today, you could share that. And let's start with Chantrell.
Take my glasses off to remove that glare. Thank you all for everything that you've been saying and sharing. One thing that stood out to me just now with what Dr. Dabral was just saying was the team effort. And I sort of want to take it out of the, in the medical sense, and just speak to the team effort it also takes for a family caring for someone who is terminally ill. And I just remember with my grandmother, there was a team effort there, and being able to trust and rely on the people around you that you love to show up for you all to be able to show up for each other and take care of this person who you all really love. And in my family, we have a lot of like doctors. So like doctors and nurses showing up. So just like even like second cousins and like doctors who are pediatricians, just all showing up and using the resources and knowledge that we have to make sure that the quality of life for this person is at its peak, is the best that it can be, and that it can be sustained. So I would just say, thinking about the teamwork that it also takes for a family and for friends to bring someone comfort and a wonderful quality of life and experience as they progress in their diagnosis.
Yeah, I'm really glad you brought up this idea of the importance of teamwork and everyone bringing what we have to the table, whatever your like talents and perspectives are. And I hope that tonight, bringing together everyone's different experiences is emblematic of that. So, well, I guess we'll go in reverse order. So then Professor Lupton, you are up next.
I think just it's about the power of listening, and that reading becomes really a form of listening in the play, and that Susie is a good listener, and that we learn from her listening how to be better listeners, and that drama is ultimately about listening. Actors spend more time on stage listening to the other actors than they do actually speaking. And that's part of the art of it. And of course, as audience members, we listen, and we listen fully. So to me, it's really about the role of listening in our lives, however we understand listening.
Yeah, that's very beautifully said. I, in my role as a med student, was just reminded yesterday of the importance of listening to our patients and in appreciating their stories. So I think that is definitely something really important that we every day try to take into practice. Dr. Coluzzi.
I'm taking something Dr. Dabral said a little bit further. I noticed watching the play and then thinking about my own career, and something that I think we need to remember, that while the public may want us to do things to them, I think we've created a situation in medicine where we have certainty. We're certain that we need to do this. We quote response rates. We quote all these disease-free survivals, all these things that are really quite complicated even for me to understand. But I think reality is the play shows us, and the nursing piece of this particularly, because that's really the palliative care component of this play, it shows us that things are really ambiguous and not really very certain. And I think that is something we need to be comfortable living with. And I think everyone in general, as humans, that's what we deal with all the time. We probably don't have as much certainty as we think. Control is an illusion, wherever the bumper sticker would be. So I think it's really important, and for yourself as a medical student and for the other medical students here, is always kind of remember that. Really check yourself. If you're absolutely certain of the right thing to do, there may be an alternative. There may be another way to look at it. And listening to the patient, you really do, again, as you know them better, you understand that it's much more complex than a statistic. So that's what I'm reminded by this, and always kind of try to remind myself of this all the time.
Yeah, I think that this is a really important takeaway for us. I think in almost every career, there is some technical aspect to what you do, where what you're very passionate about is reduced to the level of precision or accuracy. And I think even in the arts, and even in like less traditionally quantitative fields, we measure and we are critical, and certainly in medicine. And so I'm really glad you brought that up. It's something that we will all think about. And I think that this play strives really hard to remind us of. And
Absolutely.
Last takeaway point, Dr. Dabral, what do you have for us?
So I think it goes back to basic human nature. Everybody is born with some kind of art. This play kind of emphasizes the importance of art, literature, play, drama, humanities, which we are striving to nurture amongst everybody, but especially amongst the medical field. I sit on we interview for medical students also. We look for those things, and I think they are so important. Once you have that art side in your heart, it is but natural that it will draw you towards becoming a better human being. And who else can provide a better care to a patient than a good human being? So my thanks and thank you to Julia and the team to putting this together in art form. We all are playing a role in our lives, but I think we need to be in touch with our own feelings. And we use art or the role play in our teachings all the time, especially in the classes of communications.
Yeah, thank you so much, everyone.